Erectile dysfunction, otherwise known as ED, is the inability to either obtain or maintain an erection sufficient for sexual intercourse. Erectile dysfunction is very common, affecting at least 30 million American men in America. It's estimated that at least 1 in 4 men will suffer from ED at some point in their lifetime. There are multiple possible causes for erectile dysfunction, including chronic disease such as high blood pressure, diabetes, and cholesterol. It's also important to realize that men who have survived prostate cancer after treatment with either surgery or radiation oftentimes suffer from erectile dysfunction. Although it is very common, it's important to realize that ED should never be considered a normal part of aging and is treatable in almost every instance. Erectile dysfunction can be diagnosed by your urologist after taking a careful history and physical exam. Some prevention maneuvers for erectile dysfunction can be lifestyle modifications such as eating healthy, getting regular exercise, and smoking cessation. It's important to see a urologist who specializes in the evaluation and treatment of erectile dysfunction. Not all urologists perform penile implants, so it's important to see someone who specializes in penile implant surgery. There are several different treatment options for erectile dysfunction. Usually the first treatment involves oral medications such as Viagra or Cialis. Over time, these oral medications will become less effective or possibly have side effects, at which time other treatments include penile injections or inserting medications into the urethra, as well as vacuum erection devices. When these medical treatments become less effective or have bothersome side effects, an excellent option is a penile implant. The advantage of an implant achieves a spontaneous on-demand erection that is concealable and is durable and reliable when you need it. After meeting with your urologist that specializes in erectile dysfunction treatment, he or she will determine which treatment is right for you. This may be medications at first, or if the medications aren't working, you may progress on to injection therapy or intraurethral medications. However, I find that patients generally will want something that's spontaneous and reliable and durable, and whenever they reach that point, they opt for a penile implant. Oral medications have the advantage of being simple and straightforward to use and can be taken several hours prior to being needed. I will say the satisfaction rates for injection therapy and intraurethral medication are limited by burning and other side effects such as that. Vacuum erection devices are a good non-medical option for patients, but are sometimes cumbersome and difficult to create that seal. Penile implants offer the highest overall patient satisfaction rates when the other medical treatments are no longer effective. Erectile dysfunction should never be considered a normal part of aging. A lot of men suffer in silence with erectile dysfunction. We're not talking about cosmetic treatments here. We are talking about restoring function that used to be there. Over time, not having erections allows scarring to set in the corporal erectile bodies. This leads to not only loss of length, but also girth over time. The sooner you go with a penile implant, the more penile length can be maintained and allow for maintaining girth as well.